Hi, I'm Dr. Srivatsa Lokeshwaran. I'm a lead consultant and interventional pulmonologist at Aster Whitefield Hospital, Bangalore. So let's discuss today about a very vital topic called COPD. COPD stands for chronic obstructive pulmonary disease. So basically, these are a group of diseases most often caused by smoking and to some extent by environmental exposure to certain pollutants and previous infections, which causes the breathing tubes to shrivel up permanently. So there is a stark difference between having COPD and asthma, which many patients ask me. So COPD is an irreversible obstruction of the breathing tube as contrast to early stage asthma where the breathing tubes can open up again. In many cases, the COPD patient presents with chronic coughing, lot of breathlessness on doing his daily activities and is limited to a large extent. We even see patients who come to us dependent on oxygen. So what do we do to prevent COPD? Of course, for smokers, the first thing I would say is to stop smoking. That's the best way to get out of developing COPD, because if you continue to smoke, there is no doubt there is a large proportion of patients who smoke who come to us with COPD. Now, how do we treat COPD? There are various medications available. We treat them with some nebulized medications so that the breathing tubes open up, and also we help them with certain rehabilitatory exercises called pulmonary rehabilitation, which helps to strengthen their muscles so that we can at least use the muscles which helps them breathe when their breathing tubes are dysfunctional. Many a times patients with COPD also have their heart, especially the right heart, affected, and hence we need to coordinate closely with our cardiologist to also optimize the cardiac functions of these patients. How to go about managing COPD on the long run is what many patients ask me. So an important fact is COPD definitely progresses over the long run, and many of my patients also have to understand that their breathlessness might not be fully averted. They might have some slowing of their regular activities that they do, but our goal of treatment of COPD is so that they have a normal quality of life. Some of our patients are dependent on oxygen and are prescribed oxygen for at least 16 hours a day, which is vital to protect the lung and do the function which the lung is unable to do, and also protect the heart. Some of these patients also go on to specialized devices called BiPAP, which they have to wear to strengthen their muscles. This device again is not a very complex device, it's a very simple device, and many of our patients do use it on a daily basis. Most essentially, the patient has to follow up regularly to make sure his lung functions are not deteriorating, and can also take vaccines that can prevent infections, which are usually the sole causes for offsetting the control of COPD. And that control offset is called COPD exacerbations, which can be dealt with special medications either on outpatient basis or in the hospital. If any of you have queries on COPD or you have near and dear ones diagnosed with COPD, please reach out to us at Department of Pulmonology, Aster Whitefield, Bangalore.